Doctors, what's something someone came to the hospital for that they thought wasn't a big deal, but turned out to be much worse? Part 2. Story 14. Not a doctor, but I was in a fender bender car accident. I was at fault, and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back, and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours, several x-rays, a CT scan, and 4 doctors later, I found out my spine had broken during birth, and since we never knew, it just healed itself, filling in with cartilage. One of the docs told me that had we known my spine broke at birth, I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact, I was probably in a lot of pain. Story 15. When I was 12, I had a crazy bad headache that wouldn't go away. My dad brought me to the doc, and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a busted sinus cavity. As in, all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien, and they told my parents I was not going to make it. Obviously, I pulled through, but was hospitalized for 2 weeks and missed 2 months of school. I was, at the time, only the 3rd known case of this happening, and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. Story 16. A 20-something pregnant woman went into her local ER for nausea, vomiting, and a sore back between her shoulder blades. The PA had the amazing stroke of brilliance to ultrasound her soldier. What did he find? An aorta aneurysm ballooning and starting to spill. She had 1 to 2 hours to live. She was immediately thrown onto the survival flight helicopter and flown to my hospital 120 miles away. Her husband came in from parking the car and asked where she was. He was told she was on the copter and might live if they got to the big house in time. Apparently, he laughed and said, No, my wife came in with the flu. After they set him straight, he drove like a maniac down to us and almost beat the bird. Story 17. December 7th, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words, feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too because of his symptoms, and he was 79. They did a scan and nope. Cancer. 3 huge tumors in his brain. We took him for more tests the next day, and it was lung cancer. A tiny spot in his lung had traveled to his brain. He died 13 days later, on my husband's birthday. Story 18. My mother was in town visiting for Christmas. Suddenly, she was slurring her speech, acting belligerent, and all around confused. Tested her blood sugar, and all it said was error. We get to the ER and she passed out. Her blood sugar was 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset, she got a liver transplant. A 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please, become an organ donor. Yeah, you hate to think about dying early, but it's so easy to put yourself down as a donor and have that potential to save a life. You just never know. I would encourage you all to consider becoming an organ donor if you aren't already. Story 19. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started, Doctor, doctor. When we rushed in, it seemed as if he was having a cardiac arrest. So we put him on the bed, hooked up to a ECG. He had an AV block. So, the reason he probably fell from the stool was because of the AV block. At first, he was such a happy guy and joking around. After we told him what he had, he could only say, It's in my heart. This means the end is coming. Story 20. Not a doctor, but a nurse. I was working in postpartum care, and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital. We were just a women's and children's hospital to come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. That's absolutely heartbreaking for just everyone involved. I mean, I suppose in some small way it is better to know at that point so the other parent could be prepared if they are involved in the child's life or some caregiver, but that is hardly any comfort, and I just feel awful for that family. Story 21. Not a doctor, but this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones of varying sizes and that it was precancerous. Apparently, people don't typically get gallbladder cancer until they're in their mid-80s or 90s, and it is often very serious because people don't catch it right away. I'm in my 20s, and like I said, I had been sitting on this problem for 3 years until I finally toughened up enough to get it checked out. Story 22. Content warning. Child S abuse. Scroll forward 36 seconds to skip this story. I worked in an ER fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it. Maybe she's on her period. The doctor, however, was suspicious from the start. So he ordered a gonorrhea/chlamydia test, which turned out to be positive for gonorrhea. Unfortunately, we had to discharge the patient on the initial day due to some tests, such as cultures, taking much longer to result. But the very next day, we checked the results and immediately started calling CPS. Story 23. My friend's mother was on vacation in Key West, and as they were walking down the beach, her husband pointed out that the toes on her left foot were all sandy and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to a doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS, Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breathe on her own. All she thought she had was a sprained foot. I feel so bad for folks like this, where something seems so minor and then you're just hit with devastating news. To be hit with this and know that there isn't much that can be done and to know you're going to decline like that, I can't imagine what that must be like for someone to have to process, and I hope she was at least able to make the most out of her life and find joy wherever she could. Story 24. I don't work in medicine, but a few years ago I started getting a really bad stomach cramp. I couldn't bring myself to eat or drink anything, and I finally decided to have my mom take me to the hospital. I got in and they decided to take a CT scan of me. Well, being a 6-foot, 15-year-old at about 140 pounds, I had to drink some sort of liquid stuff to basically get my insides to show in the scan. Been a while, don't remember what exactly it was, tasted like watered-down Sprite. Turns out I had acute appendicitis, and they had me in the ER in about an hour. My mother keeps telling me about waking up in the recovery room and being high as a kite. I don't remember a thing. Story 25. I'm not a doctor, but a few years ago I took a positive pregnancy test. I went to the doctor to confirm, just thinking I would be getting some blood work done and maybe an ultrasound. They did the ultrasound, but couldn't find a baby in my uterus, so they told me it was ectopic, implanted in a fallopian tube, and I needed to have surgery to remove the baby. I went into surgery and woke up a few hours later. The first thing I remember is seeing my parents and my fiancé crying. Turns out I was never pregnant. I actually had a tumor the size of my fist on my ovary, and my body was reacting to it like a baby. I had hormones and everything. I'm 4.5 years in remission. I can't imagine just how frightening that would be, but I'm so happy to hear about the being in remission. Gotta hang on to those victories. Here's hoping you've been able to fill your life with all the good things you can and that you're living every day to its fullest. That goes for all of you as well. You never know what the future holds, so live now. Story 26. Nurse here. I was working a shift in a busy emergency department, and a man in his 60s walked in with a vague abdominal pain symptoms. After waiting for over an hour in the non-urgent section, he came up to the counter saying his pain was worse. He was calm and polite throughout the whole thing. Next thing we knew, he collapsed and his heart stopped. Turns out he was having a massive heart attack. We amazingly got his heart going again, and just before we sent him to the cath lab, he was sitting up and was as calm and polite as before. Story 27. Not a doctor. Found a lump in my breast. Went to a doctor, got an appointment with a specialist 2 weeks from then. Night before my appointment, I just couldn't get comfortable. It hurts to lay down. It hurts to sit up. It just sucked. I went to the ER in hopes of getting some pain meds. They took me back and started poking around, told me I had a fever of 104 and that they were going to have to operate immediately. When's the last time you drank anything? Turns out the lump was an infection and the abscess was on the verge of rupturing. I had surgery, spent 7 days in the hospital. Better than cancer, I guess. Story 28. In 2012, June 3rd, I decided to try wrapping myself in saran wrap in a heavy-duty bathrobe to sweat and try to get rid of chronic hives around my torso. I sat down and watched Captain America like a human casserole. That night after unwrapping, I found my whole torso numb like it had fallen asleep and wouldn't wake up. The next day, the numbness had spread to my hands and legs. I was too embarrassed to say anything for a week until my whole body became impossible to move. Went into ER, then MRI, still didn't admit the cellophane thing, and found out that rather than just a dumb butt allergic reaction to being the human casserole for the night, I had multiple sclerosis, and my spinal cord was riddled with inflammation. 10 infusions, tons of drugs, paralyzed for 3 months, and physical therapy every other day. Literally the worst year ever. I am so glad that you at least got to the hospital in time, and while I am sorry for how hard that year must have been, I hope things are okay now. As for the rest of you, when things seem wrong, get checked out. I know, financially, it's scary. It's scary for some people, but your health is important. Story 29. Not a doctor, but my own story. Woke up one morning with severe pain in my abdomen and trouble breathing. I thought it was from a pulled muscle and gas pains, but since I was pregnant, I knew I needed to get it checked out. Ruptured ectopic pregnancy. I was internally bleeding for 2 days. The pulled muscle I felt was my fallopian tube bursting. I should have been in worse conditions in terms of vitals, but by some miracle I was okay. Surgery removed the tiny baby that tried to kill me, and I lost a tube. Happy ending, I managed to get pregnant again by some miracle 6 weeks later. We were not trying. We now have a 28-pound, happy and healthy 8-month-old baby boy. Story 30. Not a doctor, I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I just finished an A&P class and learned about something called Brugada's syndrome, which is basically an arrhythmia that causes sudden cardiac arrest in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no actual way he actually had it, and it had to be an artifact from the EKG. The doctor's eyes widened, and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home, and had a defibrillator put in his heart before being medically retired. Too long didn't read. I accidentally diagnosed a man with a certain death. Edit. Holy cow, this really blew up. Thanks for the gold, kind stranger. That right there is a friggin' coincidence gold medal right there. Things like that make a skeptic like me want to believe in some kind of higher power because what are the chances? Hopefully you pointing that out can help that guy live a longer, happier life. Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.